Hi, it's Dr. Eniola here again. I'm a GP, and today I will be talking about how to stop painful periods without actually going to see the doctor. Now, I remember myself suffering from painful periods when I was much younger. I was a teenager. And one particular memory that sticks out for me is being coiled up on the bed. I don't even remember whether I don't think I was actually able to go to school that day. I was curled up on the bed. I was writhing in pain. I had pain in my lower abdomen, my upper thighs, my back as well. Um, I felt sick, like I was going to vomit, and I was just very weak, and I couldn't do anything for a few hours, and I had to wait for hours until the pain actually stopped, and then I was able to eat or do whatever it was I wanted to do that day. Now, some of those symptoms I've mentioned, like the lower abdominal crampy pain, the pain in the upper thighs, the back pain, feeling sick, some of those symptoms women get, girls get when they have painful periods. Other symptoms are tenderness of the breast, diarrhea, bloating. Those are symptoms that some women and girls can get when they have painful periods. So how can we actually stop these painful periods? What kind of things can we do? Right. So one of the simple things that can be done to stop this is gentle exercise. I know, right? Yeah. So gentle exercise. So we're talking about things like walking, things like cycling, and even swimming can actually help to either stop it for some women or just reduce the intensity. Okay. Now, another thing that one can also do is apply some form of heat. And this can be your good old hot water bottle or like a heat patch. For some women, this is actually enough to settle their pain. Now, something else that one can also do is take painkillers like paracetamol. So, for some people, paracetamol is just enough to sort their painful periods out. Moving on to other medications like what we call the non-steroidal anti-inflammatory medication, NSAIDs. That's a mouthful, isn't it? Yes. So these NSAIDs, an example that you can get over the counter is ibuprofen. Ibuprofen. Yes, ibuprofen. As long as you get the gist. So ibuprofen does tend to help really well with painful periods. So these help to stop the effect of prostaglandin chemicals that are produced around the time of the period that cause the pain. Another way that ibuprofen can help as well is also to reduce the amount of bleeding. Okay, so one tip for using ibuprofen or NSAID for period pain is at times trying to take it either the day before if you know that your periods are quite regular, like clockwork, or sometimes taking it maybe when the pain is about to start, or sometimes taking it when the bleeding starts, whichever one comes first. And the reason is just because this can help to prevent the pain from building up. Now, remember, with your NSAID, some people might not be allowed to use it. So, some people that have asthma, some people that have kidney problems, or some people that even have ulcer. So, always remember to read the box, your paracetamol or your ibuprofen. Try any medication you have, read the label for some more information to find out if it's something that you can have. Okay. Now, the other thing as well is if you are struggling with any of these medications over the counter, you're not really sure, you can also go into your local pharmacy, have a chat to the pharmacist for some help. Mm. Now, some of you are thinking, well, I don't really want to talk to anyone about it. You might feel embarrassed, and I totally understand. But you have to think about it this way: we poo, we bleed. Okay, that's it, and that's life. And so you should actually be open about speaking about these things. And to be honest, these healthcare professionals, like your pharmacists, are trained to speak to you about this problem. So go out there, speak about it. If you're struggling, claim back your day. Okay. I hope that was simple enough. So if you've tried any of these measures I've spoken about and they work for you, will you let me know in the comment section below? And if you've actually tried and they've not worked for you, really you need to be seeing your healthcare professional, your doctor, or seeking medical attention, as there can be other medications that we can prescribe for you. There might be some tests or scans that need to be done. And I will be talking more about this in another video. Okay, so till I see you again, Don't forget to share with someone that this video can help, and also like it as well. Thank you. Bye.